course, out in the Western Cape with the MEC for Health there being Nomafrench as well. So the minister is indeed with Nomafrench Mbombo, the Provincial Health MEC then. Let's cross over live to that now.
Cape Town and some of the other nearby districts are going to be seen, described as hotspots. So there are specific interventions that are relating to the hotspots. In particular, the health response is more intensified at that level, where we have to ensure that there are specialized teams that are going to give attention, firstly to finding the cases who are positive and making sure that each one of those are tested and are taken into isolation, and at the same time make sure that those who are contacts are also taken to quarantine so that we cut the cycle of infection. We have to do quite a lot of catch-up at that level, so we are therefore breaking down the districts. The metropolitan area is being divided into 8 sub-districts, and then of course we are then looking at each and every one of those districts more directly. So for every district, we're looking at the demographics in the area, the number of the population size, the kind of age distribution of the people there, and the number of positive cases. And in addition, which is also quite pleasing, look at the demographic profiles of the comorbidities, how much of hypertension, blood pressures, how much of diabetes, cancers, and so on are in the area. So the structure, in fact, the way it is actually giving us a good response now to managing health services for the future, because it means that we're strengthening the primary health care side, and we want to make sure that we can discover people before they even fall sick, or even look after them before they need to go to be in the hospital. So that plan is on course, and I'm quite pleased with that, and that's really one of the things I came to make sure I can follow what's happening. The other issue that has been of importance is to say, once people have been tested and they need to be taken for treatment, then those people need to be put in the hospitals. If they are very sick, obviously they have to go for intensive medication and case management. But if they are mildly so, those can self-isolate at home. But in highly congested and overcrowded situations, it's difficult to do that. Therefore, the role for the field hospitals becomes important. That means, therefore, that there will be people who will be asymptomatic, who will not be so sick, who will actually be taken to hospital, so that at the time at which they could still be causing infection, they will be away from their community. At the same time, they have also been taken now to a number of areas. So at the City ICC, the 860 beds are ready for occupation, and this site is the same. And I've also already been to Khayelitsha, where the sports field, the sports complex center has been converted. In this case here, we've got the warehouse that has been converted, and therefore is able to give us 338 beds. Now, this is very innovative in the way that it's been done, and what we have also been impressed with is the speed of response, because we now need to finish our beds quicker than we initially thought we would need them. So that issue therefore means for me that the work that is going on is really gearing up for a huge surge and a storm that we still expect is going to be felt in this part of the country, and of course it will come through to different parts of the country. Now, having gone through all of these areas, what has also been important is to view some of the areas for quarantine beds. We went to an old mutual building which has been converted now to quarantine areas where families can be able to be kept there, even children can be kept there. Now, this is really the core of our strategy to turn this infection around. Breaking this into sub-district means that we want to make sure that each and every person who's positive in the locality can be accounted for in terms of being positive, in terms of being isolated, in terms of contacts being quarantined, and in terms of the time it takes for the person to be away from infecting the rest of the others. In addition, there's also going to be an effort to take those who might be at risk, vulnerable, and put them into quarantine where it's possible, so that you can actually reduce the risk of those who are positive, who are can be exposed. So the teams then will walk into the community. There is already clear distribution of who those people who are having comorbidities are, where they are. And out of that process, they will then be visited, they will also be tested before they even get sick or even before they get infected, so that we are able to really move ahead again of the infection curve. So this for me has been quite encouraging. Of course, the President has expressed an intention to visit, and therefore we're also preparing for that eventuality, that we look at how the President could actually be able to view the progress in this area, as well as to come and encourage everyone to continue to do the work that they are doing. We have therefore discussed a number of challenges which we have had to discuss amongst ourselves, raised by the MEC, the Premier and the other officials. Amongst those are issues that relate to the testing. Now, you would notice that in the previous presentation that we did, we indicated that the numbers of tests in the country have gone beyond 700,000 in the whole country, and Gauteng is the one that's done the largest number of tests, and followed by Western Cape, and then the other provinces proportionally, KwaZulu-Natal and Eastern Cape and so on. That if you looked at the positivity rate, it's highest now amongst the Western Cape, with one in every 9th person turning to be positive, which gives the fact that there's a lot more of positive cases in the province. Now this means therefore that we must deal with prioritizing. So we have actually shifted more resources to be able to test the more people in the Western Cape, because of the sheer load of numbers, because of the 65% of people being positive in this province. Therefore, want to make sure that we clear as much of the backlogs that we get as possible. Now, the backlogs that we have presented before are something that we continue to work on, so that over a period we'll ultimately get over those as soon as we are able to get the adequate numbers of test kits to be able to deal with them. So we've discussed this issue and made sure that there are various approaches, that for example the targeting, the clinical management of the patients as well, to make sure that any patient, any person who's under investigation can actually be managed whilst we are trying to work through those backlogs, which makes it the person will actually get adequate treatment, despite the fact that there might have been some delays. But in the case of need for immediate management of the person, then of course those will actually be much more prioritized. All the provinces have got similar kinds of challenges, and so this is a problem that at a national level, assisted by the President and the various other friendly countries, will actually find a way to overcome. And so we see the issue of the testing as being a problem, that's something that we can manage as we move along. That was the one issue that was then discussed. The second issue, again, that we had to look at is the issue of staffing. Now, on the issue of staffing, it is quite clear now that there is a need for us to increase our staffing levels, and so the province has been able to employ over 800 nurses, and so we feel that because some of the nurses have tested positive and will be taken out for quarantine, and so it becomes necessary for us to increase our numbers. The fact that we're increasing the number of beds means that we're also going to increase the numbers of staff. So we're now calling on people to register for employment as nurses from different parts of the country. So we're going to be going all out to make another further call, both from those who are trained in the public and in the private sector, to register into our system, so that we can increase the numbers of nurses. I'm aware that next door in the Eastern Cape, a similar call yielded again over 840 nurses, and so we will therefore be calling through to say that we have this need for people to be brought in. But we are also calling those who are recently retired to also come on board, and there is a way of managing the vulnerability and risks inside the health services so that those who might be having a higher risk profile would be put into areas where the risk does not become a challenge. So then, of course, that is something that, as part of managing the COVID-19 pandemic, we have a clear way of how to manage that. That becomes a very important aspect. The second aspect, of course, is that on the doctors, we have already deployed a number of doctors from Cuba, and we have actually been welcomed by some of them here. And I want to thank the MEC in this province and the department, as well as the MECs in other provinces, for the very warm reception that our doctors from Cuba have received in the different provinces. They are now getting integrated. Already the one was giving us an orientation into Cape Town and to show us that in fact they are part of this big effort. And in the process, therefore, we believe that on the side of the doctors, it makes a huge contribution, and we're eternally grateful to the Cuban Health Brigade for the support. And then we have also made a call. 2 weeks ago, I had a meeting with the Medical Association. They raised the issue of some doctors who were also wishing to be employed, and we did indicate that we had a situation where the doctors that could be employed had been available, and at the end of it, we found that we could not fill all the posts simply because there were not enough doctors. So when somebody raised the question that there were unemployed doctors in South Africa, we have then said those who are unemployed, who are registered with the South African I think
we can in the wrong direction.
Yeah, I think that's right. It won't work. Don't worry. Don't worry. We were born under this.
It won't work. It's that side.
Yeah. No problem. No, don't worry. So we have therefore said that doctors in South Africa who are unemployed must approach the different departments in the provinces and make themselves available. But they must be registered with the Health Professions Council, because what has been said to us as lots of South Africans who are not employed, one were referring to doctors who have not been employed because they are not registered. If they are not registered, we can't discuss the issue. It's a matter of basic registration that has to be. No, don't worry. Thank you very much. So, if the doctors are not registered with the Health Professions Council, we cannot consider them, because that process is a statutory requirement that everyone has to go through. So we're not talking about those, but those who are unemployed can apply. Secondly, we have also found that there are doctors who are running private practices who now wish to come to the government. So they are not necessarily unemployed. It's just that they are now available, not that they could not have been necessarily employed before if they were available. But so we have said that those doctors can make themselves available as well. Now, I've seen some were commenting that they were doing sessions, now they're unemployed. Actually, I think we mustn't confuse the issue. If someone is in general private practice, or if someone is in private practice, then they're employed in private. Then if they want to come to the public, then they make that arrangement. But they can't be accusing a government of them not being employed when in fact they are actually in private practice, because that's another way you can get employed. But we are ready to absorb into government those who wish to move from private into public. So that we want to make it very clear, so that when we went out to ask for doctors from Cuba to come and assist us, we're basically reinforcing on the existing human resources in the country. And so if we find others, we'd like them to come on board. and be part of this. Then we are also having some other discussions together with the Medical Association and the Unity of Family Practitioners. That is actually where we feel that it's going to help us to reinforce in the Western Cape, in the Eastern Cape, in Gauteng, in KwaZulu-Natal, where we're dealing with hotspots. So we are working through that process. It's something that is ongoing work. With the private specialists, also the discussion are ongoing. There's still quite a bit of work to be done to be able to see how we're going to work together. But on that side, that's another one. So in terms of human resources, we're looking at the entire spectrum, where we'll employ and then we'll partner. So that is the one thing that we discussed as well, just to confirm that that's the way that we're dealing with. We have also sent teams here to further reinforce the provincial government. We've got some of the doctors. We've got here Dr. Nicholas Crisp, Dr. Kerrigan McCarthy, and others who came to actually assist to ensure that we can improve the coordination across the various departments and reinforce, particularly as we are looking for additional accommodation, and also as we are looking at tightening up on the shortages where there are shortfalls, so that we can work together very closely. Then in addition, we have also identified the area of beds. Now, we had a good plan about the beds availability in this province, and therefore we've gone all the way out to transform the various stadia, the exhibition center, and so on. But what we have noticed is that it looks like the surge is coming a bit quicker than the completion of the beds, which means that we have more patients than the beds. Some of the beds are going to come on stream during next week, and so we now need beds at this point. So we've actually also agreed that there has been a standing arrangement of cooperation with the public and the private sector. So we will make use of some of the private beds from private hospitals. There's all sorts of ongoing discussions so that there'll never be a situation where we run short of beds in the public sector, whereas the private sector has already offered to work with us and cooperate at this level. Obviously, a few other things that are going on, such as the debate about the cost of the beds and so on, you would expect that that discussion will always be ongoing, and so that discussion is again on course. The other issue that's been raised relates to the budget. Now, the provincial government is obviously nervous. All of them are a bit nervous to say we need authorization to spend more money, we need additional resources, and all I can do is to really assure everybody that the President has made a commitment that resources are going to be shifted onto the various provinces on the health response, and then in addition the Minister of Finance will be tabling an adjustment budget, and that will address these issues. So again, we are saying that all of that should not hinder the movement of the provinces in making sure that we prepare for the increase that is inevitable. We have noticed that in the Western Cape, the mortality has risen quite dramatically, such that in fact more than 50% of the, almost 60% of the mortality in the country has actually been located in the Western Cape, but also that about 50% of the current mortality happened in the past 2 weeks, and the increase in numbers have also happened in the past 2 weeks in the Western Cape. But that basically means that the numbers are going to be increased, so we rather need to be very, very ready to deal with this issue. So we have been given a full presentation about how all government departments are working together now at district level, and how government and civil society are already working together in creating the response on the ground for behavioral change, for supporting those who are positive, for ensuring that the issue of food relief and other social distress is taken into account for ensuring that the issues of economic activities are looked upon and reopened. All of this together requires government to work together. I've actually been taking through this whole program. Each time I've been here, this presentation has been made, and I believe it will be a very, very important presentation for the President as well, because of the approach that the President has taken, that we're dealing with lives and livelihood, and so that becomes very, very important. But in addition, the President has also said that all the ministers, cabinet ministers, need to go to different provinces to go and give support to the rest of the districts and the provinces, because it's important to make sure that government works together as a united government and work on the same basis. There's one plan, and this is a national plan that's applied in every district, in every province, and that plan is a plan that's really going to make sure that we respond to the issues of COVID-19, both the health response as well as the rest of the other aspects of other sectors responding. So that again, I believe is going to help to strengthen our response. One thing that this COVID-19 really demands is a unity of all layers of governments, national, provincial, and district or metro or local government. We need to be all together, speaking with one voice, implementing one team, supporting one another, operating as one unit, and therefore we'll be able to make an impact. I think that if we can get all of these structures set up as we are now looking at them now, we believe that if it should take probably about 2 weeks to make sure that they are on the ground and they are all entrenched properly, then if within that period to the end of the month they are able to account for each and every one of the positive cases and make sure that those positive cases are taken out for isolation and the contacts are taken out, and that there's case management, we will be able to ultimately reduce the rate of spread and therefore reduce the pressure on the hospitals, because the beds are fine. But if we cannot reduce the numbers that become positive by reducing the rate of spread and early identification of those who are positive, then we might still have a problem. So the issue is that the two aspects need to work together. Yes, good preparation in the hospitals for case management, but also very strong community response in prevention, in early diagnosis, in early quarantine and early isolation. All of that together is a package that's going to work. We have said, of course, that we hope that this will ultimately make the impact so that it makes it unnecessary for us to actually go to a full Wuhan-style lockdown, because we think that a lot of work that we are doing now is going to be based on a very systematic approach that must be able to turn things around. We remain very positive, we remain very optimistic. At this point, of course, let me also say that it is a real pleasure for me to introduce our brand new Director General, Dr. Sandile Buthelezi, who is on our right. If you can just show his face behind the mask so at least the media can recognize who he is. Then, thank you very much. We want to welcome Dr. Buthelezi. That's what we call baptism of fire. He hasn't started by going to the office, he had to start by coming to the field. That's how we believe he will understand the task ahead of him. Already he's got to make a number of very important decisions now to make sure that when we walk out of here, the Provincial Health Department is able to place the patients in the private hospitals as soon as possible, as soon as they need it. So it's going to make sure that that gets done and a few other tasks that are associated. But he's also a very experienced manager. I happen to have known him many years ago when he worked in KwaZulu-Natal. He worked as a medical officer. Thereafter, he became a superintendent in several hospitals, some district and some regional hospitals, and did a brilliant job at that level. He was again later appointed to be a program manager to manage the HIV program in the province. Later, he was then promoted to become a regional chief director who was managing both primary health care as well as the regional hospitals at that point. And he actually did his job with distinction, and he continued to operate as part of the senior management in the province before he was then recruited to go in various multilateral agencies that were doing financing and supporting programs on HIV and AIDS and tuberculosis. And later he then became the CEO of SANAC, and therefore was responsible for liaising with the PEPFAR, with the Global Fund, with a lot of other international donors. He's very familiar with the various programs, particularly as we deal with the issues of communicable diseases, HIV, tuberculosis, and so on. He's also familiar with the partnerships. Right now we're working with various partners, like we've been next door to a program which is being worked with Medicine Sans Frontier, MSF, and many others that he has worked with. So he's quite familiar with that side of issues as well. And he's also worked as an administrator or manager of a hospital, as well as a manager at a senior level in the Department of Health. So we want to welcome Dr. Buthelezi as well to this work. We're going to be here today and tomorrow. Let me therefore at this point thank the province of Western Cape, starting from Premier Alan Winde, who was with us and always makes sure he comes to receive us and gives us as much of a briefing that shows the level of leadership that they are focusing on at this level, as well as my colleague, the MEC Mbombo, and the HOD, Dr. Klute, of course, MC for Public Works, who's also with us here, Mr. Matigiza. So at the end of it, this whole team has really worked as one team, and has really been very supportive. And so from that point of view, I just want to say thank you for that. And so we just wanted you to have a sense as to where we are. Tomorrow the journey continues. The struggle against COVID-19 continues. Thank you.
Okay, thank you. Gonna wear your mask, Minister?
Yes.
Okay. Okay. Whilst the Minister is wearing the mask, we are roasted here. In medicine, anything that is under dosage or over dosage, it's too much of vitamin D, and we don't even have a sunscreen, so it is too much. So therefore, the reason that I'm putting down my mask is so that I can manage that we don't take more than 5. As the Minister has indicated that tomorrow there is the visit in the rural, which is the Cape Winelands district. And they take the media. I think it will be in Paarl, for those we start in Wittenberg and then we go to Paarl sub-district, at least for those who couldn't in Metro could be able to access that. So we're not going to be able to take much, so that's why I'm taking the mask. So I will be controlling the questions so that we can be out of here. It's too much heat here. Minister, please drink the water. The dehydration, when it comes to the heat, it's too much overdose of vitamin D. Okay, we start with the ENCA, and then SABC, newsroom.
Maybe 786.
786. 4, and then is there any other one? Down. Yeah, these are the only questions. I'm sorry, we can have the others tomorrow. Yeah, thank you.
Minister, just a few questions. The first one is around the application process for nurses. How soon can we expect that process to get underway? Is it underway? And in terms of the amount of nurses that you are encouraging that should apply, can you give us a specific number? And also just on the issue of a lack of testing kits and the delay in testing, just elaborate on that. What measures have been put in place in order to speed up the process? And just finally, it's only early days during level 3, but we've seen quite a number of, in fact, thousands of people queuing up at retail stores to buy alcohol. So having spoken to Premier Alan Winde, he sort of mentioned that this is an issue that he might try and intervene in terms of making sure that people don't do panic buying. Just your thoughts on that. Should there be an alcohol ban during level 3?
I think let's take the second one. It was SABC. Yeah.
Mariska Botha from the SABC. Minister, I just wanted to, you mentioned it earlier, a surge in the numbers. Initially we were told that the peak is expected towards the end of August, beginning September. But is that peak now going to be reached earlier? I read a report last night that said it could be as soon as the end of June, beginning July in the province. And then also, has there been any indication or finding as to the reason for the Western Cape having such high infection rates or numbers?
Well, thank you very much. We have actually said that the province should open up the advertisement for more nurses, and they've done so. They've already taken up 800, and there's more nurses registered. They will be taken up. There is no limit that we have set. We're going to look at how many people are responding, because it's not just this province. Other provinces are also looking for more nurses. So that's the kind of situation that we're dealing with. The issue around, look, we can only just persuade our people not to get involved in panic buying, and also to reduce the consumption of alcohol. It's something that we can only persuade our people, but there's not much we can do about how people behave other than just to plead with them, as it were. It's very, very important to ensure that our people keep to healthy lifestyles, and so that's really the gospel that we have to keep preaching as we talk to them. The issue around the Western Cape, the issue of the increase in the numbers in the Western Cape is very simple. It's a pattern that we expect would happen. In some situations, you will find what we call cluster outbreaks. Now, cluster outbreaks would be a group of people who are kept together, who will infect each other, and when they get out, by the time you discover one, you find that more people are actually infected. That's what happened here. It happened during the days of the lockdown, and that, unfortunately, I think it was before we had all the distancing and the masks and so on and so on. But really, those people were in the essential services that were expected to be at work. So the retail shops, the factories, the medicine production factories, the food manufacturing and agricultural areas, those were actually expected to be operating. So that's really what happened. And I think MEC Mbombo explained it very nicely, because you get people who are working together, but they're coming from many different townships, villages and suburbs. So when they get out, they go out with that infection and they spread it where they are. So by the time you discover the one individual, you only find out that in one area, one shop has got 25 people, another one's got 35 people, one factory's got 60 people. When that happens, you will concentrate on those, but in fact the damage is done in the village, in the townships, in the informal settlement, in the suburbs. So that's been the pattern. Now the real lesson out of that is that we need to emphasize on the issue of distancing and investing in the mindset of individual South Africans, because that's really how we're going to deal with this problem. And if you get the problem here, everywhere, once we loosen up the restrictions, you are very much likely to pick it up in other areas. So, for example, in the mines, in Limpopo, we've actually found a number of areas of clusters. In Northwest, in the mines, we've found exactly the same thing. So, there's a risk now of releasing the restrictions. So, we have to now expect that the numbers will go up. But as they go up, we need to make sure that most of the countries that have been able to contain the numbers, they contain the numbers by investing on the using of the masks, the hand sanitizers, the distance, and the understanding of the society that they are the ones who are now leading the fight. So that's really where our focus is.
the issue of the peak or the surge, as you said,
Oh.
was trajectory later?
No,
Is it happening?
oh no. Let me tell you. You see, the models are just a way of trying to predict. They are not expected to be right. They are not expected to be correct. So a few things happened in the first prediction. We're talking about flattening the curve for later on, right? That had not taken into account what could have happened in the Western Cape. That's the first problem. The second issue is that if you look at the whole country and remove the Western Cape, you will notice that the numbers are fairly low. Generally, the infection rate has been fairly low. Now, what that means is that the first prediction that it will be Gauteng to peak, then KwaZulu-Natal, then Western Cape has obviously been debunked. Now what we're seeing is that the Western Cape has moved up with the numbers. From what we can see, most likely what we're going to end up is that we're going to have multiple peaks. So this province will peak, then another one will follow, maybe two others will follow. So we might no longer have the typical kind of pattern that we would have seen in other parts of the country. But what we need to do is to focus on where we've already got the infection increasing, so that where we are able to get strategies to contain it there, we then make sure that everyone else is ready, so that when it gets to that level. So anything can happen. Our pattern, our pattern has been very different, because in the first instance we did not grow in the same rate as what would have happened in the north, in the Western country, and in the process South Africa took a deflection and then started a slow rise. But what we are seeing now is that you have got two patterns of the pandemic inside the same country. That means that the pattern, if you look at it over a period, it's going to have lots of variations inside the country. So our eyes are open for everything. What we are now seeing with the Western Cape, they are now using the figures in the models and looking at the scenario that might be getting refined, because the numbers, if you feed the model the correct numbers now, you are very much likely to predict what's going to happen in the Western Cape. We now have to start looking at what's going to happen in the rest of the other parts of the country.
I'm Mr. Amyazid from Newsroom Africa. I just have a question around the resources that you said the health department will pump into the Western Cape. Are there any specific resources that you will be putting in? And then also last week in a sitting of Parliament, you had mentioned that there was a shortage of testing kits in South Africa. Is there an update on that, please? Thank you.
It's very interesting how we spent the whole evening, 3 hours, analyzing the test kits. Now, all I can say to you is that when we said there's a shortage, we were testing 400, a small number. Today we've done 700,000. It's a huge number that we're not happy that we need more tests to be done. So we're still having a number of tests to be done. But what we're also saying that we're actually targeting in a specific way, so that the areas where we need urgent action interventions for clinical management, it doesn't get affected. So that part is not affected seriously. What we do see is that because we went out to get more people to be tested from the community, so some of those we've got some backlog, but on its own it does not create a problem in managing, because managing a patient is a clinical decision. So you can treat the patient with or without the results. So that doesn't become a problem. So we have got strategies to be able to manage that. But on top of that, we're actually trying to source more kits to be able to cater for this. As far as we're concerned, we should be able to deal with the backlogs at some point. But at any one time, it depends on how much testing has happened. You'll always find there's a backlog. It goes back to 2 months ago, we used to have backlogs, clear them, move on, get a new backlog, clear it and move on. So we are not really very sentimental about backlogs. We'll deal with them, and then in the process, we'll try and increase the numbers of kids as we move on.
Minister Tashirik from Radio 786. Minister, I'd like to know about contact tracing. When do we suspend the intensity of contact tracing, given that we're expecting a peak? Then I'd like to get your view on schools resuming, today, or this week, or next week, depending on which province we're looking at. Where do you stand on this? Because I think there is an understanding that children are equal at risk, but the impact is slightly different. But the concern is that community transmission back to parents, back to homes. That's the anxiety that a lot of our listeners and the public is feeling at the moment. And then maybe just lastly, on the president indicating that depending on where the outbreaks are, the clusters that you referred to, that those areas could be brought back in terms of the level, the alert level. Where do you stand on the alert level? And given the spike in Western Cape and parts of the Cape Metropole, would you advance an opinion that we should be going back to, let's say, alert level 4 or 5?
Okay, I think let's take, this is the last question, otherwise you'll end up being close contacts of each other. We don't have time to stay away from work for 14 days. So it will be the last one, so the Minister can just do all of those. And then after Minister is done, Minister Madikizela just to do the closer.
Minister Mkhize, I'm Minister from the Minister, with regards to patients with HIV, has there been enough data on that to draw a conclusion as to what the risk factor is for those patients? And then with regards to community transmission here in the Western Cape, is it happening fast, in a sense, faster than expected, or is it more or less happening as expected? And then just on the issue of the test rates, the strategy to isolate contacts depends heavily on tests, but you also said it's also a clinical diagnosis. Can you also just elaborate on what other strategies are being used for contact tracing if not being relied on tests?
Okay. Yeah.
I've got that one. I'll remind you what you said.
Oh, that one. Okay. All right. Let's deal with the first question around the children. Look, there is no intention to get children to be exposed to infection. We are saying let's try our best to prevent infection from spreading. It will happen because as we start moving around, people will actually pass the infection from one person to the other. But it's not because there's a reason why we think the children must go and get infected. That's not correct. And I think it's important that we're simply moving from a premise that says we are going to have this COVID-19 for a long time, for most of this year and some part of the next year or even beyond. Now, you can't freeze the whole country forever. So we've got to start introducing, bringing back to normality, a new normality, which is where people must now know distancing and masks and hand sanitizers and so on. But by so saying, we're not then saying we're just letting the children get infected. And I think it would be a wrong interpretation to put it like that. What the pattern of how you have seen fewer children infected, etc., that's another issue. The real issue is that the country can't be held to a standstill all the way. That's really why we have to start introducing. And for sure, we are going to find that there are areas where we put protocols, they work well. There will be areas where the protocols don't work well, and we have to correct that. So we're going to learn as we move along, because no one has got a full answer to that. So I think it's important to put the point that we are hoping that with the distancing, fewer people will be infected. Not that we find the kids can be infected. It wouldn't be correct to say so. Then if the infection happens, whether it came from the parent or the grandparent or from the child, it's still an infection. We really don't want it. We want it to be very slow. So that's the approach. The issue of contact tracing, I've said we are putting up intensive health interventions now. Those interventions are to make sure that we identify, we then isolate, we then quarantine. And therefore, a close management by a team of specialists is going to make that even more efficient. So that's what we're looking at. With that strategy, that's the one that we have got a chance to actually hold the numbers and contain them. Not that will ever stop the infection, it will never happen. But you want to slow down the numbers so that they don't get more than the hospitals can carry. So that's what the teams will do. And therefore, it is an extreme situations that we have actually said. I'm not going to say where do I stand. The President said exactly the same thing that we all stand on. And we're saying for areas which are low transmission, there's going to be vigilance, monitor, make sure we reduce the infection, make sure we avoid a rise in infection. When there are hotspots, there are intensive interventions, ensure that very strict isolation and quarantine and treatment of comorbidities and tracing people, etc., etc. If all of that fails, it might call for additional interventions, additional restrictions. It will be based on an objective situation in every part. So it can be put under those restrictions. But we are hoping that this intervention, that's why I was trying to give you a sense that it will take no less than 2 weeks to get all these teams to be set up. And then you want them to start accounting for everyone, because the whole thing goes almost in 2-week cycle. You then want to see how the change happens. But if you find that with all of that, you need to intervene, you have to actually put more restrictions, we'll do so. But we have not made a decision that that's what's going to be happening. Then
HIV, local transmission, I think you have answered partly of the contact tracing.
Part of the, yeah. HIV, we remain concerned about it. Part of the reason why we want to activate people going to opening services in hospital, making sure that people are treated, making sure that they go out and see people in their community following comorbidities, is precisely because of our concern at that level. When we put up a hospital, is when we want to make sure that people who come here can come here because of COVID-19. That people with COVID-19 don't go and contaminate other people with other treatments. Research over a period to see what's the impact of COVID-19 on HIV positive people on treatment or without treatment. We've seen a few of those instances, but we can't say we can give you an exact answer to that. In fact, if we ask some of the countries, they don't have as much of HIV positive numbers as what we have in South Africa. So from that point of view, it means that we might be the country that's going to give the world new information about what happens in this kind of association. Can I just take this opportunity just to talk through some of the numbers? For today, unfortunately, with the lighting setup we have a bit of a challenge. But just to say that we have the latest numbers of positive cases now is 34,357. And this basically means that in every province we can see increases in most of the provinces. From the Eastern Cape, the latest number is around 4,111. In the Free State, the number is 285. In Gauteng, the number is 4,231. In KwaZulu-Natal, the number is 2,565. In Limpopo, it's 192. In Mpumalanga, 131. In the Northwest, is 187. Northern Cape, the number is 82. Western Cape is 22,567. And then there are about 6 which are still not allocated. So that gives us the number that we spoke about. Now it makes just about 65.7% is from Western Cape, and then 12.3% from Gauteng and 12% from Eastern Cape. All in all, we've actually already done 742. Well, we've tested 742,742 kind of people at this point. And then out of these, cumulatively over the past 24 hours, there were 17,000 tests that have been done. Still, you have both coming from the public and the private sector. Unfortunately, again, we have 22 new deaths, so it takes us to a total of 705 people that we have lost, and would like to convey our condolences to the families and the relatives of those who have passed. And in addition, also would like to convey our gratitude to all our staff who have braved it all to look after all the people who need to be cared for. In the process, we would say the number has increased. Of the 705, 525 are in the Western Cape, and then the next is in KwaZulu-Natal is Eastern Cape with 82, then KwaZulu-Natal with 52, and Gauteng at 33. We will release the statement so you will see. But at this point, we have now got 16,808 who have recovered. So that's how
it's getting dark.
Yeah. That's how we have got the figures for today. Let me thank you again for all the support.
Okay. Thank you. As indicated, that tomorrow we are going to, because you know that Metro is a hotspot. Outside the Metro, Cape Winelands is the second hotspot. And then for Cape Winelands, we'll be targeting the hottest spots, which is the Witzenberg and also the Drakenstein. So we start in the Witzenberg, in the Serious Hospital.
All right, a very good afternoon to you. That's how we come out of that media briefing by the Health Minister, Dr. Zweli Mkhize, accompanied by the MEC for Health in the Western Cape, Province MEC Mbombo. The Minister really there assessing the COVID-19 response, giving out some numbers and basically indicating that about 60% of the country's mortality rate comes from the Western Cape Province itself. He went on to introduce the newly appointed Director General for the Department of Health, Dr. Sandile Buthelezi. So what had happened earlier is that he went on a tour. The minister went on a tour to the Cape Town International Convention Center. This is where about 862 beds are already made available to be utilized when necessary when it comes to this COVID-19. So towards the end there, we had the minister giving out the latest numbers when it comes to the positive cases of COVID-19 in the country. The Free State Province 285, Gauteng 4,231, KwaZulu-Natal 2,565, Limpopo at 192, Mpumalanga 131, the Northwest Province at 187, Northern Cape at 82, and the Western Cape Province, where the minister currently is now at 2,257. And of course, the minister saying that the province on its own accounts for about 65.7% of the positive cases of COVID-19 in the country. The second place there being Gauteng at 12.3% and the Eastern Cape at 12%. So as it is now, they've already tested about 742,000 people in the country for COVID-19. And he says we have 22 new deaths due to COVID-19 in the country. This, of course, brings the number to 705 lives that have been lost due to the coronavirus. So we're sitting at about 16,808 recoveries. So that's the gist of what came out of that media briefing. You may have heard the minister there saying that tomorrow they will continue with their tour of assessment of how things are looking when it comes to the COVID-19 in the Western Cape Province. They will be visiting the Cape Winelands district as well as Paarl tomorrow. So we'll certainly have more for you. Our reporter, Mariska Porter, is attending that briefing. But for now, let's take a quick break.